Paramedics around the country say they are stressed and at breaking point as their pay negotiations stall. St John Ambulance, which operates everywhere apart from the Wairarapa and Wellington, says it's told the Health Minister that the current 74% government funding level is unsustainable. Its latest offer doesn't include night and weekend pay rates, leaving paramedics as the only health sector workers not given sweeteners for those shifts. Some are paid only $19 an hour and say the government in St John don't seem to recognise the value of their service. Alec Spirit and cameraman Nick Monroe visited paramedics at Auckland's Manukau Cruising Club.
They say you can't be an emergency paramedic unless you're a type A personality. Before we were even ready to film, they were lining up to talk. Passionate, frustrated, some of them ready to walk away from the career.
I can't go to a student or stand in front of a school and talk about what I do and say, recommend to currently do this in New Zealand.
Andrew Ferguson is based in Northland. He's at the top of the pecking order, highly qualified, what they call an intensive care paramedic. ICPs get around $80,000 a year, but that's the ceiling for the rest of their career, and none of them get paid penal rates for shift weekends, night work or holiday rates. Why? Because St John Ambulance says it's got no money, and the government has told it to come back in 2 budgets' time.
We're so close to crisis, the ambulance service is close to breaking point. All right, we're barely keeping our head above water. You know, the staff cannot continue to go on this way.
The paramedics are desperate. That's why they've taken to scrawling messages on their ambulances with washable chalk and pens. The coloured graffiti has captured the public's attention with messages like "shift my pay" and "lowest paid in the developed world." At this first union meeting, the pens are out again and the messages go up on the glass windows. St John says it's concerned about some people using permanent ink and damaging the vehicles, and says it could distress patients and donors. But at this stage, that's not the message Andrew wants to hear from his boss.
I've had no negative reaction in the community. I've had people that have been hooting their horns, giving us thumbs up as they drive past. I've had people leave notes at the ambulance and give notes to ambulance staff saying they think we do an amazing job.
Anthony Ivan is from Pukekohe. He's also an intensive care paramedic and says he's sick of being compared to a nurse. He says the profession has changed, but the pay is 20 years out of date.
Nowadays, as an intensive care paramedic on the road, I can put someone to an induced coma, intubate them, put a breathing tube down their throat and breathe for them, cut their chest open if we need to at a big trauma scene, do all sorts of things, give weird and wonderful drugs. Now that's well beyond the scope of a nurse and indeed many doctors in many cases.
Anthony says his equivalent in a hospital is the level of a consultant doctor, and the pay does not reflect that.
Sometimes we're sedating people just to make our lives safe.
Even on his income, he still struggles, and he wonders how his lower-ranked colleagues survive.
All of our staff, myself included, need to be able to go home, pay the bills, feed the family, and not worry about whether I need secondary employment just to afford fuel and rent in Auckland, for golly's sake. When I look at my other colleagues who are further down the ladder, it is even more, tremendously more difficult for them. And that is depressing, to say the least.
In the meeting room, there's a range of ages, including a good number of seasoned paramedics. Some live and work in remote areas and have given decades of service. Some are emergency medical technicians with a diploma and on about $50,000 a year. They say that salary would immediately double if they went overseas. Andrew Ferguson says the lack of penal rates and a well overdue pay rise hurts even more when other professions are getting that recognition.
Nurses in hospitals get paid penal rates, doctors in hospitals get paid penal rates, the cleaners get paid penal rates. Currently, after their latest win, the cleaners will be paid more during the weekends than our most highest qualified ambulance staff.
Andrew says the stress is taking its toll, and he had bigger expectations of a Labour-led government.
We currently have a current health minister whose whole government is based on wellness. You know, this is their big push on mental health and wellness. We know from countless research that our staff and staff in the emergency services are at higher risks of PTSD, mental health issues. We kind of consistently get the message from them, if you don't like it, go find somewhere else to work.
Laurie Gommans says she just might.
I love what I do, otherwise I wouldn't still be here. but unfortunately you still have to make money, you still have to pay the mortgage at the end of the day, and if this job isn't going to give me the ability to keep doing that, I'm going to have to look elsewhere.
Laurie is an emergency medical technician based in Hamilton. In previous pitches for funding, St John used to highlight that New Zealand was the only first world ambulance service with single crewed ambulances. It said double crewing would benefit rural patients in particular, but Laurie says she still goes to isolated towns, some not too far away from Hamilton, and she's the only one in the ambulance.
Places like Narrawa here in Huntly, they're single crewed at night still. You're dealing with people that aren't always happy to be dealing with us, so they can be quite violent, put yourself into some tricky situations.
Laurie says that can happen every other day, and she herself has had to escape from violent offenders and call the police. And when there are double crews, the emergency medical assistant is only paid $19.10 an hour at night, working in precarious situations. On top of that, there's only a budget for that lowly paid assistant. So even if the shift has to be covered by a highly skilled paramedic, that paramedic only receives the basic rate, $19.10, nothing more for their specialist skills. The union meeting has given these medics some respite from the coalface, but one day isn't a very long time to spend trying to forget their troubles and the growing debts they're trying to wipe away. And as the day draws to a close, they turn to Dawn Lucas. She usually works the phones, receiving emergency calls, but her communication skills are also needed at the negotiation table. She says she can't get anywhere with St John staff, so she has a message for the Health Minister, David Clark.
David, we would like you to consider our request to shift our pay, to acknowledge the fact that we miss out on time with our family and our loved ones, and we want to be acknowledged for the skills and the amount of time and money that is required to get to the level that we are, and we think that we should be acknowledged for that.
And that was Dawn Lucas finishing the report from Alec Spirit and Nick Monroe.